Okay, let's dive right into this explainer. Have you ever actually wondered what you'd do if a heart attack struck and you were completely alone? No family, no friends, literally nobody nearby to help out? It's a terrifying thought, right? Being totally isolated during a major medical emergency? But hey, there is hope, and there's a rock-solid plan. Today, we're looking at 3 absolutely critical emergency actions that could quite literally save your life.
So really picture it. What if you were completely alone? If you suddenly felt that heavy tightness in your chest right this second, what exactly would you do in those first few critical solitary minutes? The actions you take, or honestly the ones you don't take, can absolutely mean the difference between life and death. Knowing your exact next steps, that's your ultimate survival tool. Now, the good news is that quick action drastically improves your survival chances. Look, heart disease is still a leading cause of death worldwide, and heart attacks, they can strike anyone completely out of the blue. So in this explainer, we're going to quickly cover the warning signs, 3 life-saving actions you absolutely must take, and some simple, everyday preparation habits to keep you ready.
And this brilliantly illustrates something so important. You've got to forget those dramatic Hollywood movie heart attacks. You know, the sudden crushing chest pain where the guy instantly collapses to the floor. A real heart attack usually feels way different. You might just feel pressure or kind of a squeezing sensation right in the middle of your chest. Maybe some unusual fatigue or even a pain spreading up into your jaw, your neck, your shoulders, or down your arms. It's not always theatrical. Actually, scratch that. It's often super subtle at first.
But it gets even more nuanced than that. We really need to talk about the mild or unusual symptoms. Things like extreme fatigue that just comes out of nowhere, stomach discomfort that kind of just feels like bad indigestion, or even just mild shortness of breath. And what's absolutely crucial here is that these atypical symptoms are seen a lot in women, older adults, and folks with diabetes. Please do not ignore these signs just because they don't seem like a big deal. A quiet heart attack is still 100% a heart attack.
Okay, so here's our survival guide action plan. 3 critical steps. Call emergency services, stay calm and still, and take aspirin if it's safe for you. Let's break down exactly what you need to do for each of these so you don't waste a single second.
All right, action 1. The very moment you even suspect a heart attack, call emergency medical services immediately. Whatever you do, please do not try to drive yourself to the hospital, especially if you're feeling weak, dizzy, or having severe chest pain. It's incredibly dangerous for you and everyone else on the road. Remember, emergency responders aren't just an Uber to the hospital. They are highly trained medical pros who can literally start life-saving treatment right there in your living room and on the way to the ER.
You know, waiting is actually one of the biggest mistakes people make. Too many of us hesitate, right? We're scared of causing a false alarm, or we just don't want to bother our neighbors or the EMTs. But listen, every single minute you wait without treatment means more heart muscle is being starved of oxygen, which can cause permanent damage. Making that call early gives doctors the absolute best possible chance to stop that irreversible damage in its tracks.
And here is a highly practical pro tip. If you ever find yourself in this scary situation, put your phone on speaker. I know, it sounds ridiculously simple, but in a full-blown panic, you might not even think of it. Using speakerphone means you can keep talking to the dispatcher while you get yourself safely seated. You can just rest, follow their instructions, and keep your hands free without burning up the extra energy it takes to hold a phone to your ear. Which brings us right to action 2. Stay as calm and still as possible. I know. Telling someone to stay calm during a suspected heart attack sounds completely impossible. But here's the biological reality of why you absolutely must try. Panic floods your body with adrenaline, and that forces your heart to work way harder. When you're all alone and your heart is already struggling, your one and only job right now is to conserve energy and wait for those responders. So, how do you actually pull that off? First, sit down in a comfortable position, making sure your back is fully supported against a wall or a sturdy chair. Don't lie completely flat if it makes it hard to breathe, okay? Second, focus heavily on your breathing. Gently in through your nose and slowly out through your mouth. And third, this is big. Absolutely avoid walking around, tackling the stairs, or trying to finish up some random chores before help arrives. Literally just stop, sit down, and breathe.
Now, what's really interesting, and honestly kind of scary about this next slide, is this dangerous internet myth floating around called cough CPR. You've probably seen those viral posts on social media, right? The ones claiming that coughing repeatedly and violently can somehow keep your blood flowing and save your life if you're having a heart attack alone.
Yeah, we need to clearly debunk that right here, right now. Cough CPR is only used in very specific, highly monitored hospital settings, and it requires strict medical supervision.
If you try pulling this at home, you are just wasting precious time and energy you desperately need to use for calling 911. Seriously, do not try internet tricks during a cardiac event. Focus all your energy solely on getting emergency medical services on the line.
All right, moving on to action 3, take aspirin. But listen up, because here is a massive caveat. Only do this if it is medically safe for you. If a dispatcher or medical professional tells you to, chew 1 regular strength aspirin. Chewing it is the absolute key here. A chewed aspirin hits your bloodstream in roughly 5 minutes, compared to 12 or more if you swallow it whole. It breaks down those blood clots so much faster.
However, you have got to run through this strict safety checklist first. Take regular strength aspirin only if you are actually experiencing symptoms. You know for sure you're not allergic to it, your doctor hasn't warned you against it in the past, there are no signs of serious bleeding, and ideally you've been advised to do so by EMS. Always defer to the guidance of emergency medical pros. Never just blindly pop medication if you're fuzzy on your own medical history.
Let's move to and see how this all builds together in a real-world scenario. Meet John. He's 68 years old, and he lives entirely on his own. When a sudden health crisis hit him, his response was a real game changer. Let's look at how he applied these exact steps to literally save his own life.
All right, so at minute 1, John notices an uncomfortable pressure in his chest and this dull pain creeping down his left arm. At first he thinks, just indigestion from lunch. But at minute 3, instead of waiting an hour to see if it magically goes away, he remembers those subtle warning signs we talked about and he acts. He calls emergency services immediately. By minute 5, he makes sure to unlock his front door for the paramedics, sits down heavily in his favorite armchair, and keeps the dispatcher on speakerphone. A few hours later at the hospital, doctors confirm that his incredibly fast, decisive action and his flat-out refusal to brush off his symptoms prevented severe, permanent damage to his heart.
John's story is super powerful, but it also brings us to a really empowering part of our explainer today, preparing before an emergency. You don't have to just wait around for a crisis to strike. There are proactive steps you can take right now to protect yourself, and honestly, they're incredibly simple to weave into your daily routine. Here are some simple prep habits you can start literally today. First, keep your phone nearby at all times, especially if you have heart disease or risk factors like high blood pressure, smoking, or diabetes. Second, share your full medical history with your family so someone else always knows your baseline. Next, keep a super clear, updated list of your meds and emergency contacts. Some are obvious, like stuck right to the fridge. And finally, if you have a medical alert device, wear the thing. Don't just leave it sitting on your nightstand. These low-barrier habits save highly valuable minutes when the real deal happens.
All right, let's do a quick, punchy review to make sure we have this firmly locked in. Action 1, call EMS immediately. Action 2, sit down and stay as calm as possible. Action 3, if advised, and if it's safe for you, chew an aspirin. 1, 2, 3. Seriously, memorize these steps. They won't magically replace professional treatment, but they absolutely optimize your chances of surviving long enough to get it.
So, the crucial point is this: trust your instincts. Please do not ignore the signals your body is sending you. Unexplained chest discomfort, sudden sweating, pain spreading to your jaw or arm. It is always better to call for help and find out it was just a false alarm than to wait too long and suffer irreversible consequences.
And of course, just a quick reminder that this explainer is strictly for educational purposes and isn't a substitute for professional medical advice. Always consult your healthcare provider before making any changes to your diet, exercise routine, or medications, and work with them closely to truly understand your personal risk factors.
To wrap things up, I want to leave you with a question to really chew on today. Have you or someone you know ever recognized the warning signs of a heart attack early? Sharing your experience, or even just staying super vigilant about your own health, could literally help someone else survive if they ever find themselves alone. Keep learning, stay prepared, and take care of that heart of yours.